For more on this mystery illness, we're joined by Dr. Marietta Vazquez. She's professor of pediatrics at Yale School of Medicine, and she joins us via Skype from New Haven, Connecticut. Dr. Vazquez, thanks for being with us. When we first learned about COVID-19 outbreak, we were told by health experts that those most at risk are seniors over the age of 65 and those with pre-existing conditions. Based on this illness among kids, is that still the case?
I think for the most part, you're correct that in the beginning we expected children, although they can certainly get infected, that the severity of the symptoms was milder. So this really came as a surprise. But I think with the number of cases increasing, we're now learning that there is this very uncommon yet serious manifestation of the virus after the illness.
So we know for certain that this is directly linked to COVID-19.
We don't. We suspect it might be, and these are all hypotheses because of the number of cases in children, all with very similar presentation. But it is true that we are not 100% certain. I would say about 2/3 of the patients who we've seen have a negative COVID test. So what that means is that the virus is not present, but some of the children have the antibody, which leads us to believe that they were infected in the past. And it's as they're getting over their infection that then this develops in a very small minority of patients.
And the symptoms, as we heard in the previous report, are also different. COVID cases tend to be respiratory, but this one is not.
It is correct. The presentation is different. The presentation is very similar to two inflammatory diseases that we know of in pediatrics that are also relatively uncommon. One is Kawasaki's disease, and the other one is toxic shock syndrome. And the way that this presents is usually children develop fever, high fevers, and after that they can develop abdominal pain, diarrhea, redness of the eyes, vomiting. They develop a rash all over the body, and that rash can be itchy, muscle aches. Some other children develop red lips, red tongue. But what they all have in common is after these symptoms develop, then they develop this inflammation all over the body. It's what we call an inflammatory storm, and that can lead to shock. And that's a term that we use in medicine when your blood pressure starts going down. So many of these children require to be admitted to the hospital, require medications to keep their blood pressure going. And one of the worrisome ones is that when I say that it causes an inflammation everywhere, the heart is one of the areas, the muscle of the heart gets inflamed, and that can be very serious.
Well, that sounds absolutely horrible. So as a parent, what do we need to look out for? I mean, if I'm a mom, which I am, and I look at my child, any of those symptoms you mentioned, knowing me, I'm gonna be freaking out at this point.
So I think it's certainly worrisome. I think we all need to be aware of them, but we need to try to sort of control the fear. I think that it is important that if a child has fever for several days, high fevers for 3 or 4 days, and develops any of the symptoms that I've mentioned before, and that this fever is not because the child has an ear infection or because they have an infected wound. It's fevers that you don't explain with other diseases. What we're urging people to do is to call their doctor and have the child be evaluated. Again, it's a serious disease. It's something relatively new that is emerging. Not everybody will get this. The majority of the children who will get fevers won't end up having this inflammatory condition, but it's serious enough that I think the parent or the person should call their doctor. And the other thing to focus or to stress is that the children tend to do well. In our hospital, we've had 3 cases, and although the cases were fairly severe, children seem to do better if they are brought to medical attention on time.
Very important points there. We certainly appreciate it, Dr. Marietta Vazquez. Thank you.
Thank you.